Good afternoon, everyone. We are really glad you've come to be part of this first gathering of Beacon Shining Light on Dementia. And I'd like to just begin with a moment of prayer. Our gracious God, we come to this event today with our questions and our struggles and our compassion and our experiences of walking with the reality of dementia in our own lives and the lives of people we love. We ask your blessing on this gathering and all we share and learn in Jesus' name. Amen. Following a community consultation in 2018, a number of people in our church started to think about what we could do as a congregation to reduce the stigma surrounding dementia and memory loss and become a dementia-friendly congregation. And what we decided was that we were going to have a series of events where we explored the realities of dementia, and we called it Beacon because we were wanting to bring a light onto a reality that we often leave in the dark. So today's is the first of the series of 4 on Zoom, and we're going to have 2 videos, one about the experience of dementia in community, and the second video is one man's personal journey with a dementia diagnosis. And we also have a guest that we've invited here today from the Alzheimer's Society to share some insights and address some questions that people have. And we hope that we'll be able to have some questions and conversation and share our experiences. So we're really glad that you're here. And our first video that we're going to share comes from the Gitxsan First Nations. And this is their gift.
I remember when my father-in-law was first diagnosed, my brother-in-law said that he was gone. Dad's gone. And I just kind of like, what do you mean he's gone? He's still here. The different family members didn't understand. He couldn't drive anymore because of the late night driving. Taking him to the bank, he couldn't remember his PIN number, or taking him shopping, he couldn't remember how to use the keypad. The simplest tasks like bathing or showering or doing laundry, those tasks became very difficult for him.
I think it was about 3 years ago that we started getting phone calls from community members saying that their family member couldn't remember, or that we'd be staying up all night, and they're really stressed about it. At that time, that we as nurses realized that we didn't know much about dementia ourselves.
One night he wandered outside and he was sleeping on the lawn, and we were sleeping downstairs and we didn't hear him leave. And when we found out where he was that early in the morning, because we heard some noise, he was had made his bed on the lawn, and that really scared us.
In our First Nations culture, because dementia was never mentioned like 50 years ago, this is all something new. It's here now. Back then, when our elders were getting old, people would say, oh, they're just tired. They just want to rest now. You know, they've had their days. They never thought about dementia.
You know, I understand now it's an illness.
Dementia is a collection of neurological symptoms. So within the brain can change over time as a result of many different things that might be happening to it. And the symptoms that come out of those changes are what are called types of dementia. Alzheimer's is one of the best known or well-known types of dementia. It is often the one that we refer to, or doctors refer to, the most. We know that in British Columbia there are approximately 70,000 British Columbians who have a diagnosis of dementia. The incident rate of dementia in the Indigenous First Nation population is 34% higher than the general population in BC, which is about 5 to 7%.
The biggest thing is knowing what dementia is, understanding that they're cognitively, there's things that are going to be changing for them, and to have understanding patience.
When people start getting forgetful, they don't really tell. And so it goes quite a ways, and then others start to notice. When family notices that somebody has dementia in their family, they often don't really reveal that. They kind of gather around and maybe protect that person. They just manage as best they can. People need to be helped to talk about it, to talk about what their needs are, because everybody's experience with it is different.
Yeah, there was signs, small subtle signs that I didn't recognize in the beginning. He said he didn't want to drive at night anymore, so he drove through the day. He wasn't paying some of his bills where he was usually right on with paying his bills and doing tasks like that. I noticed that he started losing interest in a lot of things, all these activities, and then one day he just stopped, and we knew that something was going on with him.
It happened to us twice, my mother and then her mother. With me, I noticed it right away. Like we'd bring our grandchildren, and yet she knew them. She'd say, "Who is this?" Her little habits, she'd forget to do things. Other things started to change, like when we took her shopping with us, she thought she was shopping for the 8 kids that used to live in her house. And then going outside of the house unsupervised, she needed supervision. And doing strange things like that, going outside for walks without a coat. And then the hardest part is when she started, she forgot my name, forgot who I was. That really hurt.
For me, it was just feeling at loss for the person that it happens to. Just watching the person not be the same person they were. And yet she was a really independent woman.
Probably one of the main challenges is not getting a break, because we had to do this 24/7. We didn't have someone that could come in and give us a break.
Just doing things, just taking care of my mom when I didn't know how. I had to learn another language. I had to learn her facial expressions.
We had to kind of educate ourselves and prepare ourselves and community members, because a lot of community members saw him wandering but didn't understand what was happening. So we had to share within community that if you saw him wandering and if he was going too far, to ask him if he was okay or to pick him up and to bring him home.
The community needs to know who the people are. It's really important that we remember that it takes the whole community to look after a person with dementia and to make sure that they're safe in the community.
Because I wasn't trained to deal with my mom with her dementia, I didn't realize that, because I would raise my voice and get upset with her, then he would say, "Marlene, don't talk to her like that. Sit down, calm down. Talk to her quietly. Communicate with her."
My niece, who had training, told me what to watch for, told me how to talk.
When you have dementia, some caregivers don't understand and they talk to that person like they're a child. But after I started learning about him having dementia, I would kneel right to his level and talk to him very clearly and no distractions, and that was really what helped us. I guess treating them with human dignity, love and respect is important, and part of the healing for them is feeling loved and cared for. I think the biggest thing is knowing that we have a culture, and respect is one of the highest things we can do for that person, is showing them love and respect, and to have understanding, patience, giving them that sense of being in control of their own lives rather than us making decisions, is keeping them involved in those decisions and understanding where they're coming from and not trying to push anything or pressure them, or to have respect and to have love and support so that we could heal as a family. The other thing is the language, because when you're in the healthcare system, you don't have the Gitxsan language. You actually need a translator.
When my mother was in the hospital, a young man, he came up to me and he said, "Your mother's asking for mush. What is mush?" And I looked, "Oh," I said, "she's asking for porridge. That's what our people called it way back in the day. I want to have some mush." And he goes, "Oh," I was wondering what she was talking about.
One elderly lady that spoke Gitxsan fluently told me in Gitxsan, "It's very hard to be Malu," she said. "I'm going Malu." So what I would do is I would just hug her and ask her, "How are you feeling?" And because a lot of the people that have dementia, they can be so clear and they know that something's going on in their brain. They know that things aren't right. And when they come through, she was able to express that to me, and I would just hug her and thank her for sharing. It's kind of like a wave. When a wave comes, you have your lows and then you have your highs when they're doing well, and then you have your lows again.
And then you cling to the moments where she has clarity and she knows you and she knows everybody, especially at community events like feasts. I think people with dementia should be always surrounded with what's familiar, especially people.
Another lady that was asking me if I could drum and sing for her. She used to do it many years ago, and she's got dementia now. And so I started singing one day as I was caring for her, and she stopped and she said, "Oh, do you know those songs?" And I said, "Yes." And then I started talking to her, like making small gestures in Gitxsan, like "Amalawina, how are you doing?" Or, those small gestures of talking Gitxsan, those small gestures of sharing our culture, our singing, our songs, our dancing, all the different things, and talking about what it was like for them when they were healthy, bringing back memories for them, I think really allowed me to share my heart, my culture with them to help heal them. And I think that's the spiritual part of having that energy and transition of changing them and making them feel like, this is who I am and that's their identity.
One of the things that's so important about supporting someone with Alzheimer's is having what we call a person-centered approach, is ensuring that that individual is seen first as a person with strong connections to their culture, to their language, to their beliefs. And then once that is understood, is to ensure that then the support that is for the dementia is tailored around that, so that person continues to be as active as possible in their community, but the supports that are necessary to support their dementia is also present.
When we started doing education training on dementia, that to me really opened my eyes in a lot of the signs and symptoms that my father-in-law was experiencing. It wasn't until I started really learning about dementia when I started getting emotional, when the tears were able to come and I was able to finally put my mark.
Before we just let the family look after them because we didn't understand much ourselves. But now that we know, we can go into the homes and teach the whole family how to care for them. It entailed going into the communities and talking to family members and seeing how they're coping with a person with dementia. And we wanted to hear from them on what worked for them and what didn't work for them. And we wanted to know what resources would help them to keep the family member in the home as long as possible.
When people begin to talk, then you can recognize where you can begin to develop programs or insert services.
We worked with Alzheimer's Society and First Nations Health, and we brought in talking circles because that's part of our culture, going in a talking circle, and we feel more comfortable. We develop trust at the same time.
We had 2 talking circles. One was the initial information gathering, and then the second talking circle was to bring the conclusions back to the community. And the people were very, very excited. They had lots to say about it, and they said, we need to do this a lot more. The Alzheimer's Society is interested in doing a lot more outreach. They have a hotline that you can call if you have questions. You can just phone them and they'll find you answers. There's a lot of potential to have a lot of support around people dealing with dementia. There's no cure, but there are things you can do to make it better for the person that has dementia and for the caregivers.
I know that the dementia is only going to get worse, but at the same time, I'm going to embrace everything that I have and what he has to offer to each other and to support one another.
I think when you realize that your family member has memory loss, you should go to the health station, get support and education, because we're here for you and we'll be out there to help them.
And I think the first thing I want to say is a big thank you. A thank you to the Alzheimer's Society of BC and to the Gitxsan people for so honestly and gently talking about how they've explored dementia in their particular context. I was really touched by their honesty in relating and how it stirred their emotions. It also seemed to call on their courage to ask questions. And as I listened, I could see how they learned to talk about dementia and then brought in their culture and how that was important and how each person needs to be addressed respectfully and individually. So that is our first segment of our time together. And for our next segment, I'm honored to introduce our speaker, Sana Aziz. Sana is the provincial coordinator for dementia-friendly communities at the Alzheimer's Society of BC. She has her master's degree in gerontology from Simon Fraser University. And when she did her thesis, she focused on person-centered care practices for people living with dementia. She's been with the Society since 2017 and held different positions in the programming and services area, and is now part of advocacy and the education team. You'd be interested to know that Sana also sits on the Dementia Friendly Canada initiative. It's a working group, and she is the BC lead. Today, Sana will talk to us about many aspects of dementia, but especially those that affect our heart and our community life, our congregation. Before I turn it over to Sana, I'd like to remind you about using the chatbot function found at the bottom of your screen, or if you're on a mobile device, by tapping that device. We'll be monitoring the chat and we'll gather up your questions, inquiries, or comments for our time of discussion. And that will come at the end of the full presentation. So, Sana, a really warm welcome from all of us.
Thank you, Susan. Thank you to all of you. Very good afternoon. Thank you for having me here today. I'm really honored to be here, and I'm so deeply touched that this group has taken the time to come together and talk about a very, very important part, a very important piece of our community, and that is dementia and people and families living with dementia and what it really means and how we can make a difference in that community. So I'm going to go ahead now and share my screen. So just give me a moment here, please. And okay. So how's that looking for everyone? Okay. As Susan mentioned, we will try to keep this session, the time that we have together, as interactive as possible. I would encourage all of you to use the chat box feature to interact with me. There are a couple of times that when I will ask you to put down your questions or answers as we go along through our the presentation. So please, I would encourage you to take the time to do that. And if you're more comfortable, you're also welcome to unmute and answer as needed. So as Susan mentioned, my name is Sana. I'm the provincial coordinator with the Alzheimer's Society, and my work really is around dementia-friendly communities in BC. I'm going to go ahead and turn off my video because sometimes I feel that interferes with my presentation. So I hope you can still hear me. Today we're really going to be brief, but we're going to talk about an aspect of dementia that's often felt but not spoken about, and that is the stigma that is associated with dementia. And I'm going to talk a little bit about how the society works to create dementia-friendly communities and really where the important work around that and what you can do in the community to be a dementia friend. So we'll start with some myths and stigma stats that have come about from a study around dementia. And like I said, we'll go over some initiatives that the society really fosters into the community. And then I'll wrap up with some hearing a little bit from you about what you think you can do in this community, and we'll hopefully have a rich conversation there. So before we begin, let's start. I'm going to ask some questions. And I know we initially when we practiced, we had hoped that the polling feature would work for Zoom, but we all know technology can be a good friend and sometimes it won't. So we don't need to rely heavily on it. So I'm going to pose a couple of questions, and I'm going to also monitor the chat box to get some answers. You're welcome to type true or false in the chat box when you hear my question. If you're more comfortable, you're welcome to unmute yourself and answer true or false. Again, this is not a test. It's just, this will allow us to take our conversation forward. So I'm going to ask the first question, true or false? Dementia is a normal part of aging. False. I hear some, oh, good, I'm reading some answers. False, false. False. Thank you for those who are participating. Thank you very much. And the answer is false. Yes, dementia is not a normal part of aging, but as we get older, our risk does increase. While most people living with dementia are over 65, a few people in their 30s and 40s also have been known to develop it. In fact, I was in a working group last week and I learned from somebody living with dementia that she's on an international group, and she said the youngest member in that group is only 18 years old, which was quite eye-opening for me because that's a number I had never heard before. Thank you for participating. I'm going to ask another quick question. People living with dementia no longer have a meaningful life. True or false? Again, lots of falses, false, false, and that's correct. That's the answer. That is, unlike a lot of stigma around this particular comment, many people living with dementia live meaningful lives, active lives for many years, for a number of years, before, during, and after they've had a diagnosis. A lot of the people that we know especially as well come forward and put their energy into public speaking and advocacy. And a great example of that is our leadership groups comprised of people with lived experiences who we really heavily depend on, as we do the initiatives in the communities. And my last question before I move on is, true or false, dementia is not preventable or curable? So dementia is not preventable or curable at this time. True, correct. Thank you to those who answered. Most dementias do not have a cure at this time, nor do we know how to prevent them. But having said that, and as we saw in the video, there are ways that the community can come together and support those who have a diagnosis so that they can continue to live the quality of life that they have done so for many years and continue to enjoy. Great, thank you. Thank you for moving along. You're probably wondering why I asked these questions. A lot of times the stigma associated with dementia is based on the society's stereotypes of the disease. As a result, we may, as a society, choose to believe what may or may not be true about the disease, but it just stems from what the preconceived notions that we have and the stereotypes that have been created. Stigma is known to be one of the biggest barriers for people living with dementia to live fully with dignity and respect. By definition, stigma is any negative attitude or discriminatory behavior against people living with dementia. And the unfortunate reality is that any person living with dementia may encounter stigma. Even though 500,000 Canadians live with dementia, many feel excluded, ignored, and treated differently for something beyond their control. A couple of years ago, a study was conducted with about 1,500 Canadians regarding attitudes towards dementia. In that study, alarmingly, 46% of respondents felt they would feel embarrassed if they had dementia, while 61% of those surveyed said that they would face discrimination of some kind. 1 in 4 Canadians believed that their friends and family would avoid them if they were diagnosed with dementia. And only 5% of Canadians said they would learn more about dementia if a family member, friend, or coworker was diagnosed. 56% of Canadians are concerned about Alzheimer's disease. And one of the greatest concerns is the fear of being a burden to others, losing independence and the ability to recognize family and friends, as we also saw in the video. Only a few, 39% of respondents said that they would offer for family or friends who were open about their diagnosis. We can take a lot of time to go into why these numbers are the way they are, but that's not the purpose of our time today. But the purpose of sharing these stats was so that to inform you that we all can play a role in reducing the societal impact of stigma through care and inclusion, as well as building a dementia-friendly society. Before there is a cure, there is care. Until a cure is found, the society's vision for a world without dementia must begin with a dementia-friendly society, a world where people living with the disease are welcomed, acknowledged, and included. But we know we cannot do this alone. It will take a dramatic shift in our culture to support people living with dementia, their caregivers, and their families. It will take a culture change, a movement. And by joining the movement, you're helping to create a world where people living with dementia feel supported and inclusive. So how do we realize our vision? By building a community of care. a community engaged in moving away from fear and denial of the disease, dedicated to creating a foundation of understanding and awareness. So this is the idea that really forms our approach at the society. We center people living with dementia, their caregivers, and the families. They are the innermost circle here in light blue that you see in this diagram on the screen. We support them throughout the progression of the disease and amplify their voices through initiatives like our leadership groups. And as I mentioned earlier, the leadership groups are composed, we have two big groups. One is of people living with dementia in the community, being advocates, being support, being those voices. And the other group is comprised of caregivers for people living with dementia, so that we're able to hear what it feels like for them, what this journey looks like from the eyes of a caregiver. And these were great examples in the video that we heard as well and saw as well. So let's go back to the diagram and then look at the middle or the brown circle, which represents the community of care. People like yourselves who are here, who want to understand dementia and are committed to fostering a dementia-friendly province. The outer circle, which is the yellow circle in the diagram, is really the general public. The people who you see walking on the street really don't know anything about dementia. They go about their days, never really thinking about it, never really being affected by it. Our goal here at the society is to grow the middle circle and shrink the outer circle, bringing more people into this movement, more people who want to be dementia friendly and want to be inclusive. I'm going to pause here for a second because I'm feeling like I'm talking too much. So I'm going to pause here really quickly and ask you what you feel, what comes to mind when you hear the words dementia-friendly community. And again, you're welcome to type, you're welcome to unmute yourself, whatever you feel comfortable. There are no right or wrong answers, so please don't hesitate to share what you're thinking. Anybody? No answer is okay too. Accessible programming. Thank you, Anne. I'm seeing a lot of people thinking, oh, wonderful, more answers. Where people feel respect, people who will listen and be open and curious, people who will slow down to listen, inclusive love. Oh, so lovely. Where people are treated with respect. Great, amazing, very, very good. Flexibility of response to individuals, absolutely. Respect and patience, moments of joy, so important. So important. I'm hearing the same thing. Be curious and affirming of a person. Excellent. Lovely. Great response. Thank you, everybody. Exactly. And again, before we go on, everything isn't sad all the time. Excellent positivity. Ask them what they need. Absolutely. Don't assume for them. Don't assume you know what their lives are like, who they're like, what they're doing. It's beyond the disease. The person is more than their diagnosis. Excellent. Thank you for participating. And again, learn from their history. History is such an important part because even though the memory may be lost, there is research to confirm that the long-term memory does exist and continues to live. And it's important to tap on that, tap on their learnings, tap on them, what gives them joy. Thank you. Excellent. These are fantastic answers. And for everybody, a community, the meaning or the would be different for what it is really to be dementia friendly. And before I dive a little bit more into that, let's again throw some stats. I want you to really imagine the magnitude of what we're really talking about today. There are about 70,000 people living with dementia in BC, and we know that approximately 60% of those people live in the community. And when we talk about creating a dementia-friendly initiative, it's really supporting those 60% and the others who may not be in the community, maybe in other homes, maybe in more in traditional long-term care homes, but really being that support by bolstering the efforts of local communities to have that education, have that knowledge, so we can actually bring this change together. Going to move on. I'm here. I am going to turn on my camera, and thank you for that message. I'm also going in between slides in my notes. So I just want to make sure that I'm focused. And but thank you. I note that you want to see me, and I'll be turning on my camera very shortly. Thank you. So I'm going to go ahead and move on and share some examples of what really I mean when we say dementia-friendly community. There are three things that really speak to what it means to be dementia-friendly. Inclusion of people affected by dementia. So as we heard in the responses here, asking them what they need, learning from their history, including them, raising awareness. So doing the things that we're doing right now, having these conversations, and stigma reduction. So those really go hand in hand. And some examples of that would be a community member in the society is educated about dementia and knows that a person living with dementia may sometimes experience the world differently. So education, even as we learned in the video, is really, really important. It's really, really key. And some other things to consider when we talk about what it is to be dementia friendly is a community that focuses on the inclusion of people, not with dementia only, but also their family and friends. We often hear from care partners, we often hear from people who have had a diagnosis that they're no longer invited to things that they were doing before, things that they were participating in before, to dinners, to golf tournaments, because people sometimes don't know how to engage with people who may have had a dementia diagnosis. So sometimes it's not that people don't want to include them, they just don't know how to include them. So it's important to realize that sometimes not doing anything is not the answer. So education plays a really big part in this movement that we're trying to create. Any questions? Anything that's coming up right now at this time before we move on? I'm going to take that as a no, and I'm going to move on. So as a concept, this initiative started in Japan as a way to accommodate an aging population. From there, it was embraced by the United Kingdom, especially through the creation of the Dementia Friends program, which was championed by UK Prime Minister David Cameron at the time. Since then, it has received significant uptake in other parts of Europe as well. And now in Canada, we're following suit, and through our provincial initiatives in BC, Ontario, and others, we're creating this movement and actively working towards becoming dementia friendly. Our approach at the society really is focused on 3 pillars. And again, the reason for talking about this is for you to be able to see how you fit into these pillars and what you as a community member can and are affecting this movement. When we talk about these initiatives, we talk about the professional sector, the community groups, and the general public, where we train and educate people to become dementia friendly. Let's look at what it means to be dementia friendly for the people. The first pillar of people is focused on providing information and education on topics such as what is dementia, the myths, communication strategies, common behaviors to individuals so they are better equipped to be supportive and inclusive of people with dementia in their communities. We provide these dementia friends education to various sectors across the province. We also provide sector-specific training for staff in areas of recreation, transit, library, first responders, faith-based organizations like Cures, just to name a few. And again, what is the purpose of having this education in different sectors? It's really enabling the service sector to be mindful of what it means when they are actually catering and providing services to anybody in the community, and being equipped to understand the signs and symptoms of what it may be when somebody comes in and maybe feeling differently, responding unconventionally, maybe not asking for traditionally asked questions at the time. So really knowing that it could be more than what you can see, and how to really communicate effectively and provide that service in a dignified way. The second pillar of practice is really important as well, because it really ensures professional groups have access to resources and information to respond to the needs of clients affected by dementia through their services. We have I'm losing my words, specific sector toolkits. For example, we have toolkits for people in the finance industry, in housing, in the legal industry, as well as in people in recreation centers. All places of society where people may have that interaction, so that the service sectors, the professionals who may usually go about their day not knowing or not being in any way connected to dementia now have the opportunity to have that education and that knowledge they would need to really become dementia friendly. The biggest part of the work that we're doing, and really where we envision that culture change or that movement will happen, is in the municipal sector, in really the grassroots level, where we focus on our policy. The policy is the central element of the work that we do. We're currently supporting 15 plus communities across BC to work towards becoming dementia friendly. We've all heard a lot about the age friendly initiative that BC has embraced, and our goal and our aspiration is that dementia friendly will be as important, as looked at, and as included in the action plans and in really the heart of the work that municipalities and cities do for their community. We're in the last few minutes of our time together, and my purpose of giving you an overview of what our vision of the society really is, so that it maybe inspires you, it maybe has an aha moment with you, or it maybe makes you wonder what you can do in the community to really help to bring this movement and this initiative along. Does anyone have any thoughts around that from what we've talked about so far? And how can you help to become dementia friendly? And let me maybe share some initial thoughts. Perhaps consider ensuring that you and those around you know how to recognize dementia and communicate appropriately. Could be one of the first or key things to think about when you're trying to be supportive and inclusive of people around you. Consider being a dementia friend. And you may ask what that is really. It's an essential part of creating a dementia friendly community. And here's what we think are a great quality of a dementia friend. Again, alluding back to some of the answers that you shared at the chat box before, being respectful towards people living with dementia, whether we know they are or not. It's just being respectful, period. If people are behaving or are coming across as differently, being respectful, living with dignity. I'm reading some comments on the chat box saying, remember that we are a faith community. Okay, that's a question. Okay, I'm going to hold on to the question, Ken, and come back to that in just a few minutes after, if that's okay. I'm just going to go back to the qualities that we were talking about of being a dementia friend. Make a person living with dementia feel accepted. Think of ways how you can do that. What are some ways that you could create that acceptance and inclusivity? Focus on the person's strengths and abilities instead of maybe the things that they may not be able to do as they did before. Offer assistance when needed rather than doing nothing at all. As we said earlier, not doing anything is sometimes not the answer. Everyone here, everyone on this call, everyone in the community has a role to play in contributing to a dementia-friendly community. Some other comments that are coming along is it's important to know who are support people to others. Absolutely. Do not label them. There is no they. Each is unique. Absolutely. Often when we do this education, the one thing that we emphasize on and we talk is when you have met one person living with dementia, you've only met one person living with dementia. Because every person's journey is unique. Every person is living this differently, and also being mindful that we cannot label people. We're one society. We have being inclusive really just means you treat them as we treat each other equally. It is not their fault. Remind them of this. The communication piece is so key. Include people. Everyone wants to feel useful. There are always ways to make a person feel included and needed. Absolutely. It goes back to tapping on those strengths and abilities remaining of a person. And we have those. If it may feel in the current moment that those are lost, once you get to know the person, try to understand. If there's a will, there's a way. Find ways to laugh together. Absolutely. Absolutely. Great points. Absolutely. And again, just the way our definitions of what it is to be dementia friendly community may differ, so would our definition of being a dementia friend. It's important to know people, know them at a level, and being able to support them at that level. And as I wrap up really quickly, while I would love to go into detail in all of these points, are there 5 things that I want to take, I hope you will take away about dementia after our conversation today. It's not a natural part of aging. It's not just about losing your memory. It can affect thinking, communicating, and doing everyday activities. It is possible. It's very, very possible to live well with dementia, and the community of support and care that we're creating here will hopefully help in that process. There's more to a person than a diagnosis of dementia. They are a person first. The dementia is a part of their journey. It's not their only journey. And lastly, the Alzheimer's Society of BC is always here to help. This is our Dementia Helpline number. We're available Monday through Friday from 8 to late in the evening. This number would encourage you to keep it, share it with your community. Call if you have any questions, if you're curious, if you want answers, if you've seen something in the community that you'd like to report, like you talk about. If you're a person who may be experiencing some changes within yourself and you don't know where to go, call this number. We'll brainstorm with you. We'll try to really understand and maybe talk with you on what those changes could be, offer some steps, offer some strategies. If you're a caregiver who's experiencing or helping someone or caring for someone living with dementia or memory loss, call this number for support. Just call this number to talk if you don't have any questions. We all know in the value of communicating and being there for one another. So I'd urge you to call this number if you have any questions. And lastly, here's my call to action. This is what I'm asking from you today. We need to make British Columbia and Canada a safe place, an inclusive space for everyone, whether it's somebody living with dementia or anyone in other parts of their journey facing any challenges or any situations that they may be in. There's a lot we can all do to eliminate the stigma around dementia and empower people to live inclusively and as well as possible. Join us in challenging the stigma by demonstrating compassion. I know this is the group I can speak to this about. Say with very, very, very confidence and clarity that show compassion, show understanding. A hug goes a long way. Well, not in COVID, I understand. This is probably not my pitch during a pandemic, but a smile goes a long way. We can't do it alone. The society is relying on people like yourselves to help in this movement. And I want to say thank you for having me today. Thank you for thinking of bringing this to the group. Thank you for having this conversation. Thank you for being the change that we all want to see. So with this, I'm going to stop sharing. I'm going to turn my video on and I'm going to look at the comments that are coming in because I may have overlooked some. And I'm also going to perhaps let someone from the group take the lead and tell me what the next steps are. I'm sorry I went a few minutes over time and I hope that's okay. But I'm again going to perhaps mute myself and read through these questions and then maybe we can address them in a few minutes if that's okay. Okay. Thank you everybody. Thanks for being a great audience and a good listener.
Excuse me, how do we ask a question?
Good question.
Okay,
Susan, go ahead.
Okay, Zana, you can carry on with your process and I'm going to jump in here. Kay, there is, if you put your cursor over the bottom part of the screen, there's something called share screen and you click on it and then a sidebar opens and it says type your message here and there's a little cursor and then you can type your message right in there. Or you can ask a question at our question time and on a live way. You don't have to type in. So as we move along in our program, realize that you can also ask questions without having to type in. there'll be time to ask them face to face. What I would like to do right now, though, is say thank you to Sana for both all the information which was there, but very much for your engagement of us as a congregation. You got us into the process of thinking and sharing together, and we could all see the answers as you read them out or hear them. And personally, I found that really, really helpful because, as you pointed out earlier, this is a topic that can cause embarrassment. It can make us feel like maybe we shouldn't be talking about it. And yet we know that we'd like to be doing something. So there was a huge positivity and engagement of us in your presentation. And that, to my mind, and personally, frees me to talk more freely and to listen more deeply and to explore more curiously and be open to what might work in our community. So I really do appreciate your input, and we look forward to engaging with you after our next short segment. This next short segment is going to focus on someone who is actually living with dementia. This is Jim, and Jim is somebody who enjoys being a spokesperson for dementia, as you will see. And he has his own way of living with dementia, how he encounters it. And he has taken on his diagnosis and done a lot of adaptation so that he can live well and feel that there's real meaning in life. So I'd like to introduce now our next segment, which will be a short segment called Jim's Story. Thank you, Jordan.
More than 70,000 people in BC are currently living with Alzheimer's disease or another type of dementia. People with dementia are in our communities, working, living, and participating in activities, enjoying their neighborhoods. A part of creating a healthy city for all is creating a place where people feel safe, included, and a sense of belonging. This disease does not just affect older adults. People can develop dementia in their early 60s, 50s, and even 40s. Jim is one of those people, and here is his experience.
My journey started 8 years ago at the age of 58 when I was diagnosed with Alzheimer's disease. It's a strange disease to fully grasp. People look fine on the outside, but the problem, the degeneration of the brain, is inside. It's also a disease that has a stereotype built around it. In fact, there is no stereotypical person living with Alzheimer's disease or other dementia. Everyone has a different journey and will maintain different strengths, abilities, and capacities along the disease trajectory. I want to share my personal experiences with dementia because I hope that they might cause some aha moments or provide a sense of confidence for someone experiencing many of the same things. I hope, too, it might show that there is life after a diagnosis of dementia. For me, it is so important to educate. I talk about my journey with Alzheimer's to challenge the stereotypes. I believe that through awareness and compassion, we can become a more inclusive community. Recently, I went to buy a newspaper and pulled out change from my pocket. I looked at the coins and looked some more, but couldn't identify the coins to use to pay for it. Out of frustration, I put all the change on the newspaper. The cashier picked up the amount she wanted, and we moved forward. One small example of patience and empathy. Some time ago, when I was at home, I had to call emergency services. In my rush and confusion to dial 911, I realized I should have used our portable phone. I hung up, which I should not have done. I ended up with all these people in our house and the RCMP knocking on the door to investigate why I had called 911 and hung up. A firefighter was asking me questions. So was a paramedic and a police officer. People were milling about, and they all seemed to be talking. I gather I handled the situation well enough, but if that were happened today, I wonder, if I were unable to respond adequately, how would the officials deal with me? Would they understand? Would they show me patience? Or would they see a healthy man and discount any thought of a possible dementia? Would they take a more aggressive approach? For 25 years, I worked for CP Air and Canadian Airlines, and during my career, I traveled frequently for business. One particular time at an airport that I knew well, I went up the escalator and then down again. 2 different times. I turned right and then left on the main floor until I told myself to get a grip. I finally asked for help to find my flight. I was astounded at my inability to take charge. Now, 8 years into living with Alzheimer's, I've come to realize that I have good days and bad days. I suppose the same can be said for all of us, except when I have a good day, it means I get to exercise my independence. And when I have a bad day, when my mind is too muddled to do much on my own, it means I need support. For a person who loved and thrived in business, I am now limited in my daily activities to doing 1 real task a day. Is that frustrating? You bet it is. But my life isn't over. I do have a purpose, like doing this video to tell you that we all have a role in creating inclusive, dementia-friendly communities, so that people like me and the guys in my support group can keep on living as well as possible. People with dementia need to get out. We need to socialize and get exercise. Sometimes to do this, we need a little push and extra support from our friends and families, but also from our communities, from the cashier at the grocery store or the bus driver to the staff at the local community center, or from the folks just out walking on the street. The first step to doing that is dismissing the stereotypes we hold about people with dementia. Like the time at a hospital emergency room when I insisted my wife Alice accompany me to the examining room because I have Alzheimer's disease. A senior nurse in the ER told me I didn't need her with me because I looked fine. And that's part of the problem, isn't it? How is someone with Alzheimer's disease supposed to look? You can't see the degeneration of someone's brain from the outside. Despite her education and experience, the nurse had displayed a familiar stereotype about Alzheimer's. She'd assumed that as soon as a person is diagnosed with Alzheimer's disease, they immediately become incapable and incompetent. It's probably obvious to say, but looks can be deceiving, and that is the challenge, which is why I wear this lanyard. For me, it's an education tool. I am showing a willingness to talk to anyone about Alzheimer's. I make the most of teachable moments to help break the stereotype of a person with Alzheimer's disease. We all have a role in creating more inclusive, dementia-friendly communities.
For more information and resources, or to learn more about the Society's Dementia-Friendly Communities initiative, please contact the Alzheimer's Society of BC.
Jim is a pretty amazing individual if you think about the kind of things he does on a daily basis. I was impressed with that video the first time. Well, both times that I've seen it. At this point, now we've done really well. We said it was going to be an hour presentation, and we're an hour and 5 minutes. So for those people who were planning on it being an hour and need to get somewhere else, we thank you for your participation, and you are most welcome to go if you would like to, and we'll know that you came for the presentation, and that's fantastic. But we also wanted to spend another 15 minutes while we have Sana here and each other, if people wanted to share some questions and some conversation. So we'll be here till about 10 to 3 if you would like to, but if you need to go, we're really glad you were able to go, and go with God. So who has some of the questions? Maybe I'll just turn it over to Anne, because she had been collecting and watching some of the chat and some of the questions.
Deborah, I put into the chat Ken's 2 questions in summary form, and it would have been about the last question put in the chat box. Remembering that we are a faith community, are there specific ways we can assist as a community in creating a wider dementia-friendly community? That was Ken's first question.
One of the things that was surprising.
Thank you for that question. Sorry, Deborah, do you want me to go ahead and answer that? Or would you like to... Sorry, I just kind of jumped in there.
Oh, no, I would be happy for you to answer it. I was just going to say that we're one of the first churches that you've worked with. So, so I'd be happy.
That was what I was going to say too.
So as a church, what can we do?
That's a great question. And are you able to see and hear me okay? Because I seem to be having a little bit of a poor connection here. Okay.
Yeah,
So
you stalled
I'm here.
out.
Thank you for probably one of the first churches that I'm working with to bring this education. But I'll already see a few things that I think you're already doing in working towards becoming dementia friendly. And number one that I'm seeing is that you're all present, you're here today. And that goes to show the commitment that you have within your organization of wanting to be inclusive, of continuing to be inclusive, of continuing to pay respect and dignity to everyone around you. So kudos to you for taking the time, taking that initiative to talk about a very, very sensitive topic, which, as we said, comes with its stereotypes, comes with its own preconceived notions and its own fears and avoidance. So kudos to you as a group for taking this on, for talking about this. Another thing that I want to kind of go back to earlier on when Susan really briefly mentioned about the physical characteristics of your environment, of your physical environment, your building. And I know Susan and I've had very, very high level talks about that, of how can you make your environment or your physical building more dementia friendly. So consider that when we talk about creating a dementia friendly community, we perhaps look at 2 different ways. One is the physical aspect or the physical characteristics of an environment, and one is the social aspect of the social characteristics of the environment. So physically in your building, is it accessible? Is it easy to navigate? Are there enough good signs? So those are some tangible things that you can do as a community, and we always say that being dementia friendly is not just limited to people living with dementia, it helps everyone in the community. The other aspect to consider is the social environment, which is having more education, having more to firstly talk about this, to be able to openly communicate with people if coming into your church, coming into your congregation who may be experiencing any form of dementia. So what does that mean? Showing patience, showing taking the time that one needs to have those conversations, being mindful that you could be talking to somebody in a gathering, in a congregation, who you have those congregations, when you have those dialogues, what language are you using? You know, is somebody living well with dementia? Is somebody suffering from dementia? So just the choice of words, your choice of person-centered language. These are skills and education that we can acquire. It's available. It's a matter of taking that commitment. So these are some specific ways that you can work towards becoming dementia friendly. And you'll notice me saying working towards becoming dementia friendly, because it's also important to recognize that you're never done. It's never that you have become dementia friendly, because there's always the elements, there'll always be things that we will continue to work towards as there is more research, as the new learnings come in. We know people are different. Everybody's living with this uniquely. So really it's about twofolds: making your physical environment dementia friendly, your social environment inclusive and dementia friendly. And the third part really is showing that commitment which you all are internally to be inclusive. Does that help in a little way?
It certainly helps me, and I'd be interested in hearing from people about what's the best thing they've learned about connecting with people who have dementia or their caregivers. Like, I think for me, one of the best things I learned was from a nurse on a care ward who said that my energy was too high. I needed to calm down and pretend like I was on island time, that I just have to relax and slow down a little bit, because a lot of distractions are if people don't understand what you're saying, they understand the energy with which you're saying it, and it can make people anxious. So just calm down. Everything's going to be all right, and we talk. And that was one of the best things I learned. I'd be interested from other people, what's one of the best things they've learned or been told.
I have one. It's Heather, if I'm not on your screen. I know that my aunt, my great aunt, loved to hear readings from the Bible, and it just triggered something with her, and she could remember things like the Lord's Prayer and and Psalm 23, and she would recite them along. And we could do that every week that I visited. It was always new to her. And she loved old hymns, which I think is something we could remember to incorporate more often, maybe for people in our community. Oh, but my story of her, that what I remembered from a caregiver is that I was trying to take her outside one day, and she was resisting so hard, and I knew she didn't know me anymore, but just reminding her that I wasn't a nurse and I wasn't trying to force her to do something she didn't want to do. Because all day long she's getting wheeled here and wheeled there because it's dinner time or it's nap time or whatever, and just saying, I'm your relative, I'm here for a visit, we're going outside to give you some fresh air, would that be okay? You know, and so yeah, it's along the same lines of slowing down, but also, even though she doesn't know, to give her some level of understanding of what is happening in this moment.
Hello, it's Maggie. I took the course from the Alzheimer's Society when my mom was diagnosed with Alzheimer's disease. And I can certainly echo Heather in that she could remember all the old hymns and all the scripture passages that we all memorized as children. But there was another story that really stuck with me. And that is that if there is an event where somebody is upset because they're being told to do something, perhaps rather than asked if they would like to do it, or encouraged to join in, if they get very upset, long after the cognitive memory of the event is gone, the emotional memory will last for hours and hours. And there's nothing wrong with the emotional memory. It is not affected by Alzheimer's. It lasts for such a long time. And of course, that makes it more painful because it goes on for such a while. That's what I remember.
Can I add something here? That's such a good point, Maggie. And, there's a quote by Maya Angelou who says that, I'm just paraphrasing, that people may forget what you did for them, but they'll never forget how you made them feel. So you're so right. The feelings will always stay, and sometimes they may not be able to communicate verbally. People are often able to tap on the nonverbal communication. So that's a really, really important point. I'm so glad you brought that up. Thank you. And Heather as well. Very, very good point. Asking for permission is a really key theme that's coming out as well. Reminding people and asking if they'd like to. I love the way you said, can I take you out? Is that okay? So yeah, I just wanted to say thank you for bringing those things up.
I'm remembering that Kay and Bud had a question and wanted to make sure that we got around to that. So I just thought I'd flag that, Deborah.
Can Jordan unmute Kay and Bud? And maybe they can ask that question.
Yeah, click there.
I think you're on now.
You're on now. Yeah.
All right. My question goes back to the very beginning, because my mother-in-law had Alzheimer's, in fact, passed away from it, but the family was quite unknowing about the situation because we all live somewhere else. And I'm still at the point of, how do you find out if your relative or loved one or whatever has Alzheimer's? Do you start talking to the doctor first? And is that going to embarrass the patient? Do you go without the person who's being spoken about? I mean, because you don't want to embarrass them.
Absolutely.
But you have to sort of know when it's of a point where you should know and change your relationship with them.
So I'm going to rephrase your question just so that I understand it correctly. I hear you asking, at what point should one know that it is time to get a diagnosis, or if you're noticing signs, when do you know that it's time to take it to the next step? And how do you talk to the person you're seeing the signs from?
Right.
Is that right?
Right.
So there are many folds to this. And you mentioned that if it's so firstly, I think it goes back to who is this family member and what your relationship is with that person, right? So that's number one. And if it's, for example, somebody in close proximity that you're seeing and you're visibly noticing the changes. So often, people will ask us whether it's a normal sign of aging or whether it's something to be concerned about. And so we'll,
Right.
We'll talk about, for example, I'll give you, forgetting the name of someone you met last week at a choir, for example. Completely normal sign, normal. It can happen to any of us. But forgetting the name of a family member or your nieces and nephews or your grandkids that you've seen, of you've raised. A little bit concerning, forgetting where your keys are happens to us all the time. Quite a normal forgetfulness story. But consistently putting your keys, for example, in the fridge or putting them in a place that's not usually used. So something alarming. Constantly wandering away, wearing, so there are visible things considered, visible and invisible ways that you can assess whether it is feeling like something could be wrong. The other part of your question was, how do you take the next steps? What are those next steps? So typically we'll always encourage family members or caregivers or who will call us to see, we're noticing these signs, what should we do? We will always say, talk to the person first. Talk to the person that you're concerned about, your family member, your loved one. Tell them that you're noticing these things. Perhaps journal, help them, ask them ask them if they're feeling this way too. A lot of times a person's own fear about what it could be, as we even saw in our first video, people will keep it to themselves. They'll try to cover it so that it does not come out because they're fearful, they're embarrassed. So having conversations in a dignified manner, being clear about why you're showing concern, and seeking for their permission if they would like to then get some medical advice. Because most often than not, if you were to go talk to the doctor in their absence, because of privacy, because of those confidentiality, you may not get the response that you'd like from the doctor as well. For the most part, the doctor may come back and say that you need to, this is not a conversation I can have with you. We've had instances where the person with dementia has already spoken to the doctor, is privately communicating, but the family is not aware. And that's okay too, because it's their right. They have their right to be confidential, and doctors will sometimes not respond to those questions. But it's important to keep the person, bring them along, because it's about them. And although your heart is in the right place and you're seeking to support and be there for this person, it's important that the consent is received to be able to take this forward. Does that help a little bit answering your question?
Yes, as long as, if the family doesn't know or realize at what stage should the extended family be aware if suddenly, they don't maybe live in the same city and suddenly stories of changed behavior, what Billy or Jimmy did or something, it was crazy. It's very hard for a layman or a non-medical person to say, oh my gosh, their memory's going, he's asked me the same questions 5 times in 10 minutes. And that's abnormal.
Although they may be showing signs, of concern to, for example, you being far away, it's still important to speak with them, to ask them if they're noticing other signs. And if you're feeling that you're too far, if they're too far away, then perhaps talking to a neighbor, talking to somebody who's interacting with them more frequently to learn a little bit more about what could be going on. Perhaps just hypothetically, it could be something else, because anytime you go in and speak to a doctor about possible signs of any form of dementia, the first thing doctors will do is do a process of elimination, where they will try to review and see if there's anything else it could be. So could it be delirium? Could it be a response to some new medication that's causing the memory loss or causing behavioral changes, and so on and so forth. And once they've eliminated all of that, then they will consider that it could be dementia and then seek further testing for that. So I guess what I'm trying to say is that sometimes being far away and not really being the person to witness those changes directly, you're right, can inhibit the kind of help that you can provide. And that's why it's more important to really reach out to the people that are around them on a more regular basis and offer help. And always, the society, for example, the Alzheimer's Society is across Canada. So they are always welcome to seek help or call their local society for more information. And similarly, if you'd like, you're welcome. We can talk about this more in detail if there's a particular incident that you'd like to talk a little bit more about. So I'd be happy to chat with you on that, or you're welcome to call the helpline, because I may or may not have answered your question directly today, and I'm mindful of that.
Thank you. And the other addition is this COVID crisis. These same people will be spending much more time alone, which is harder for some people than others, and certainly not as much communication. But anyway, thank you. That helped.
Yeah, thank you. And I thank you for bringing up the COVID lens, because really that's something as a community, it's all the more important and to really come together in creative ways to support one another in this time, because you really very well pointed out that people are isolated, people are alone, people have been removed from social settings, and that impacts everybody in different ways, with or without dementia. So thank you for raising that good point. And I have another question that was in the chat box. I just want to quickly answer that. The question was again from Ken to ask if the society, the Alzheimer's Society, assists members of public who need information and support in other dementias. Absolutely. Although our name is a little bit misleading, although we are the Alzheimer's Society, we're absolutely very well equipped and trained to answer and support people living or have questions about any form of dementia. So feel free to call the helpline and gather. We're able to, and if we don't have answers, we'll try to find you those. So absolutely, yes, any form of dementia.
What is FTD? At the end of your prose that's on the screen, it says example ALS. I know what that is, but what's FTD?
FTD is frontotemporal dementia. It's a type of, I hope, Ken, that's what you're referring to. So jump in if it's not, but typically FTD is frontotemporal dementia, where it is another type of dementia, and it affects the frontotemporal lobes of a person before other parts of the brain. And so how a person with that diagnosis may have other symptoms, and memory loss is not one of the first symptoms of somebody who may have frontotemporal dementia. Temporal dementia, yes.
Dementia.
Now we've got Linda asking one more question or one comment, and that will be our last for today. So go ahead, Linda. I'll get you to unmute. Oh, can she do that, Jordan?
There. Sorry, I was hitting the wrong thing. Just on FTD, I got emotional actually seeing Ken mention it, because my dad, who died almost 2 years ago of FTD, people didn't know about it. So I wish in some ways we'd had this group a while ago, because his symptoms were so different from Alzheimer's that even when he was in care, they didn't understand him at all. We worked for 14 years trying to educate them. So this is amazing already that we're talking about something that isn't just Alzheimer's, because his behaviors were misunderstood and people thought he was a bad person because he could talk so well. His speech was great, but the personality changes and some of what would be considered antisocial behaviors weren't well received. So I just wanted to say thank you for talking about dementias that are not just Alzheimer's, which are more commonly known. So thank you.
Thank you for sharing your story, Linda. That's really powerful. Thank you.
And I appreciate, I just feels like this could go on all day, which is one of the reasons why we thought we would do probably 4 sessions during this year. And the next one, I think we're going to plan sometime in January or February, and we're looking to do something about storytelling, our own experiences of either having a diagnosis or loving someone who has a diagnosis, or being a professional involved in the care of people, or being a member of the church community and sharing some of our stories. So that's going to be kind of the next thing we're looking at. as we're kind of using the affirm process of opening up conversations that allow people to be more expansive and inclusive and educated and destigmatizing. And this feels like such a good beginning. And I'm really grateful to Sana for being with us today and for this wonderful group of people gathered, and for the committee who is very passionate and sharp about what kind of things we can possibly do, and open up a whole new way for us to speak to each other. So what do I better make sure there's no more details. It says, oh, resources. Sabina has 5 or 6 books. This is from Chicken Soup for the Soul, and it's Living with Alzheimer's and Other Dementias. And they're tiny little stories, maybe 2 pages long each. And she has some you can borrow. We don't have our library open these days, but we have a way that Sabina can safely get a book to you, or you can get it. All right, it has cards.
So just get in touch with me. Most of you have my email through the church, and I can also put my email in the chat box, and somehow I'll get it to you.
Fantastic. So if people want follow-up conversations, you can certainly contact me. And you can also, Jordan will put up a screen at the end with the contact information for the Alzheimer's Society and the helpline, and those addresses for you as well. So thank you everyone for gathering today, and blessings as you go into this gray day, but go with light in your spirit, and knowing that there's this incredible community of saints around us who lift us up all the time. God bless you all. Thank you.